So we did the French healthcare system, and presenting is Grace Kirkwood, Ashley Smith, Ava Haubrick, and Caroline Kirker. So our first theme, we wanted to discuss the overall experience, and all of our interviewees said that they felt very lucky, grateful, and satisfied with the healthcare system. They talked about how it was very easy to get reimbursed, and it showed the protectiveness of the system. There's a great pride of France. Again, very protective. That was a huge theme. And they ensured, the French healthcare system was ensured that it would be easy to get care and medication when needed. The downside of this may be that the medication was overprescribed, which we talked about in class. And they, even one of our interviewees, Ava's, did not have private insurance and only used the carte sociale, and that still gave her great quality with the system. It was, most respondents believe that others would have the same opinion with the analyses within this country. And it's very accessible, easy to use. A huge portion of care is covered for everyone. And Grace's interviewee talked about how the country with like the private insurance would cover a big portion of it on top of the government. So you would only have to pay like €1 for general practitioners and things like that. And as did my interviewee, said the same thing. They feel very grateful, as I said, and they feel that this system is super universal, which was the whole point of it. And that like breaking an arm, never having to pay, feel super lucky. That was what mine said. And even going to level 1 doctors, which are going to be your basic doctors that aren't like, you don't have to pay more to get into level 2 or level 3, but even going to them, you're still going to receive good quality care, even if you have higher waiting times, is what the main theme was. And yeah.
Across all the interviews, two of the best parts of the French healthcare system, according to the interviewees, were costs and accessibility. So the general costs of healthcare are low. And as we talked about in class, and as Grace's interviewee confirmed, people are able to see a general practitioner for about €25. And medication is typically free. And the French healthcare system is really consistent with reimbursements. And within 1 to 2 weeks, people see 70% of that $25 reimbursed into their bank account. And as is uncommon within the Iron Triangle, even with such low cost, citizens are really happy with the quality of care that they receive, even with the level 1 doctors that Caroline referred to before. And secondly, people feel like the healthcare system is really accessible, and anyone with a residence in France for at least 3 months can qualify for health insurance. And PUMA is a system that was started in 2016, and it covers all legal residents and workers. And you're starting at a baseline that supports people's right to healthcare, since these level 1 doctors are providing consistent healthcare. And emergency care is typically 100% covered within the French healthcare system, which allows people to get care when they need it. And something that I think France could set an example for in healthcare for the rest of the world is prenatal support and childcare. After 7 months of pregnancy, the entirety of mother's healthcare is covered, and women are entitled to 16 weeks of paid maternity leave. And this encompasses 6 weeks before giving birth and 10 weeks after giving birth. And maternity leave is paid, so women get their full salary while they're on maternity leave. And after giving birth, there's creches, which are childcare facilities that are either public or private, where families can send their children to receive childcare. And additionally, there's assistance maternelle, which can come to the house to help families with their newborn. And with this system set in place, it helps women and children stay healthy since they're getting medical care that they need, as well as allow for an easier transition back to the workforce if mothers wish to return to work, which helps the economy and the healthcare system stay stable.
So getting into the areas of improvement, both political parties agree that the budget for healthcare needs to improve. My interview was telling me that both Le Pen and Macron agreed that they need to expand their healthcare budget. He also talked a lot about nurse and physician shortages, especially during the pandemic, and believed that there should be higher pay for nurses. And Caroline's interviewee said there needs to be a better financial balance to keep the best doctors in the system, because doctors are not willing to work in public hospitals because they do get paid more in private hospitals. Also, there are a lot of geographic inequalities, which seems to be a recurring theme for the Bismarck model countries. And Macron is working on developing access to e-consultation in those rural areas, because my interview was telling me his goal is not to create more hospitals because it doesn't make sense to open up a hospital where there's only 200 people living, but he does want to improve access to care through e-consultation and improve the quality in currently existing hospitals. There are also longstanding inequalities between the rich and poor, as you're going to have in many health systems. The poor or unemployed receive La Couverture Maladie Universelle, and they can go to rank 1 doctors where the price is regulated and these doctors must accept everyone. However, my interview was telling me there are sometimes longer waiting times and the quality of care can be lower in rank 1 doctors as opposed to rank 2 and 3 doctors. So the quality of rank 2 and 3 doctors can be higher, and that is only accessible to people that are more wealthy. Lastly, he talked to me about the poor quality of care during COVID-19, specifically residential care for the elderly in EHPADs, he called was the name of it. And he said it was a disgrace how people were being treated in these facilities. Some people weren't washed for days and were locked in their EHPAD like a jail, and some died because of poor treatment. So he really told me how COVID-19 exposed the cracks in the healthcare system specifically for the elderly. And in addition to that, there were a lot of overcrowded facilities in general during COVID-19. So there needs to be a lot of improvements to mitigate that.
And then overall, in comparisons to other healthcare systems, we only had 2 of our interviewees that had experience with other countries or had lived in other countries. My interviewee had lived in Germany and in Canada. In Germany, she found that it was a very similar system to France. They both are the social security system. So being also from a EU member state is really easy to navigate that system. And then her experience within the Canada healthcare system was not as efficient as she found the French system. She found that there was really long wait times. And then also, I think something that played into the factor of her poor experience within the Canada healthcare system was that she was an international student there. So finding a good doctor was hard without knowing the system. And then also having to pay out of pocket for dental was something that she hadn't really experienced in the past. And then Grace's interviewee had time in the UK, the United States, and mentioned Cuba as well, and found that he was surprised by the quality of care in the UK just because of the difference in the healthcare system between France and the UK, which is built off of a beverage model. So it's purely government funded. And then the same thing is true for Cuba, had a good experience and is also purely government funded. So the tax dollars of the citizens pay to keep it running. And then in the United States, he found that it was really only good for those who had a lot of money, were rich, but for those who were in lower classes or even the middle class, had a hard time getting the care that they needed. And then finally, we can go to our discussion question. So how do you think that these responses in France compare to the United States? And then how do you think the responses vary across age groups and those with different insurance plans? So we all had a varying range of age groups, starting from like young adult to like more older and middle-aged people.